It's been just over a year since we began a search for the successor to Dr. Richard Jonas, and I'm very pleased that Dr. Dudicum has arrived, and he's here today to tell us a little bit about himself and his practice and give us a little bit of his observations as he begins his new part of this career in Washington, D.C. Dr. Dudicum, tell us a little bit, I'll call you Yves. Tell us a little bit, Yves, about your background in training in congenital heart surgery and how you got started on this path.
I was born in Canada. My father was an engineer, and in the end of the 50s, he migrated to Canada to work, came back to marry my mom, and then as an engineer, traveled a lot. So my first years, my first memories start in Iraq, in Baghdad. And then we went back to Belgium, and I did most of my education years in Belgium. I went to medicine, and my path toward pediatric cardiac surgery was a very progressive one. I was damn sure I wanted to be a surgeon in the middle of my training. And then from general surgery, I quickly veered to vascular surgery. Then I wanted to become a cardiac surgeon. And I like the most technically challenging discipline. That's why I probably veered to a pediatric cardiac surgery. I think it was being more complete as a cardiac surgeon, being a pediatric cardiac surgeon than an adult cardiac surgeon. But that came just progressively.
So tell us a little bit about the Canada experience. This was in Toronto, is that right? Which is really one of the leading hospitals in North America, certainly. What was your experience there, and who were some of the special people that influenced your career?
My big mentor, and I was really influenced by him, was Dr. Tyrone David. I reflect a lot about that because when I got to him, he was approximately my age, actually. And so he was becoming the leading figure in his field. And the people I trained with said, there is this new guy in Canada. If you want to do some innovative surgery, you should go and watch him and train with him. And that's why I went to see him. He said to me a thing that I constantly repeat that year. And he said to me, your training is like a pyramid. The wider the base, the higher you get. And I always remember that. And I think it characterized my training pretty well because Belgium was very strong in coronary surgery, valve surgery, artificial hearts. In Canada, I got the best of aortic valve surgery, mitral valve surgery. Tyrone David has become the leading figure in valve repair for more than 3 decades now.
And you must have also had some experience with ventricular assist devices and mechanical support of the circulation in Toronto as well.
I had spent 1 year in South Africa, and so I was one of the few guys who mastered medical English. So every time the team were coming, they were inviting me in the lab, and so I got my hands on, and so I quickly became the number 2 of the unit in terms of assist device.
So after you left Toronto, you go back to Belgium, but then you find yourself in London at one of the world's great children's hospitals at Great Ormond Street, and there you met Marc de Laval. So tell me about how you arrived in London and a little bit about Professor de Laval.
I have a little story about that. There was a crucial moment when I came back from Toronto to Belgium about my choice of becoming a pediatric heart surgeon. And I had no intention at the time when I came back from Toronto to become a pediatric heart surgeon, but the job was to do part-time pediatrics. And so Professor Chaland was the guy who taught me cardiac surgery. He was a professor in the Faculty of Medicine. And he really liked pediatric heart surgery. Solid, really good surgeon. And it was close to his heart. So one evening, everybody had gone from the offices. He came back. He was retired at a stage. And he asked me, Yves, what about pediatric heart surgery? Do you like it? I said, doesn't matter whether I like it or not. I mean, there's no job. I mean, too small number of patients. I mean, what's the point of me liking it or not? But then he said to me, that's not what I asked. I said, do you like it? And I stepped back and I thought, yeah, I like it. It's a nice surgery. And he said to me then, if you like it, you should train in it. So you should invest in your training in pediatric cardiac surgery. The patients all will come. They all will come. And so I came back to my wife that evening, I said to her, I think I'm going to train in pediatric cardiac surgery. She said, no, because we had been by that time in Toronto, came back, moved all the times. And then she got to the idea. And so Marc de Leval was godfathering our unit. And so I came to him, and he's very proud, but he trained all Belgian pediatric heart surgeons because he felt a bit guilty to have left the country. So he wanted to give back to the country. Didn't work so much for me because I left after a few years, but I'd made my contribution to Belgium as well. And JOS was an amazing place. I thought, it's one of these places where, as a fellow, as a trainee, you had a voice. So that was a place where you openly discuss all ideas. So you discussed case, and they would invite people who were more junior like me to express their view, ask questions. There was this breed, this communication. De Leval was a fantastic surgeon, but above all, he was a great spirit and would always take the right decision during the operation. And he was admirable at that level. And he had a work ethics and a way to make decisions for families and patients that was absolutely unique. It remains a beacon of inspiration for me.
So after you left London, you then arrived at another famous institution for treatment of congenital heart disease at the Royal Children's Hospital in Melbourne. What led you to Melbourne, Australia?
So when I trained with this Belgian pediatric heart surgeon, I asked this stupid question that only cardiac surgeon would ask because we're driven by ego. And I said, who do you think is the best cardiac surgeon in the world right now? And at the time, and that was the end of the 90s, that surgeon thought a little bit and said, probably Roger Mee in Melbourne. And so Melbourne, I don't know if it's the best or not, that's irrelevant, but Melbourne has created a generation of superb surgeons. Roger Mee, Bill Brown, Sunji Sano, and every people who went there had a reputation of being good technicians. After a few years of training in London, I was so frustrated. Every time I was going to an international meetings, I was seeing video of surgery. I said, give me the instruments. I mean, I think I can do, I can do better. Give me the patience. But I didn't have the patience to flourish as a surgeon technically. And for research as well, I thought I could do a lot more than I was doing in Belgium. And so they advertised the job in Melbourne. I applied and I was selected for the job. And my wife kindly agreed to move with 5 kids between 6 months and 8 years of age, which is quite admirable, without knowing anybody in Australia, no connection. So that was a big move.
I should also point out that Dr. Jonas, who was our former chief of cardiac surgery here, also did much of his training in Melbourne as well, and also, I think, did spend time and has enormous respect for Roger Mee. I think he also spent time with Brian Barrett Boys and other famous people who were founders of congenital heart surgery.